The Centers for Disease Control and Prevention, CDC, the expert body on coronavirus, has released guidance for general public and healthcare professionals on the symptoms of the virus. A person could be at risk if they have any or all of the following: fever and symptoms of lower respiratory illness, such as coughing or difficulty breathing after traveling to areas with positive cases, or having close contact with someone who is ill and is now under investigation for the virus in the past 2 weeks. Fever or symptoms of lower respiratory illness after having close contact in the past 2 weeks with someone who has been confirmed to have the virus. The CDC defines close contact as being within about 6 feet 1.8 meters or within the room or care area of a person with the coronavirus for a prolonged period without appropriate protective clothing or having direct contact with the infectious secretions of a person with the virus without protective clothing. Coronaviruses are particularly dangerous for people who have weaker immune systems, like young children and older adults. To protect yourself from the virus, try to avoid contact with people who display symptoms similar to those of pneumonia or the common cold, like coughing or a runny nose. Don't touch your eyes, nose, or mouth with unwashed hands. Wash your hands frequently with soap and water and scrub for at least 20 seconds. Use alcohol-based hand sanitizer when possible. Be careful when handling pets. The only current treatment for coronavirus being offered is supportive in nature. If you notice any of these symptoms and conditions, please contact your nearest professional healthcare setup. Help spread this information to everyone.
When you feel a sneeze or a cough coming, try to prevent sneezing or coughing into your hands, as this will contaminate your hands and spread germs. Covering your mouth prevents the spread of germs. You probably knew that, but the way you cover up also matters. And that means breaking a habit you've done all your life. Cover your mouth and nose with flexed elbow or a tissue, not your hands. Discard the used tissue in an appropriate bin immediately. Then, wash your hands with soap and running water to help stop the spread of germs. Turn on water. Wet hands. Apply soap and lather up. Focus on washing your hands for at least 20 seconds. Wash the front of your hands, the back, between fingers and around the nails. Rinse hands under running water. Use something clean to wipe your hands, preferably a disposable paper towel. The best way to wash your hands is using running water and soap. But sometimes we don't have that available. When not available, use hand sanitizer that should have at least 60% alcohol content. Your health is your responsibility. This message was brought to you by the Ministry of Health, St. Kitts.
flowstudy.co. The Flow Study site should open. If it doesn't, go to www.google.com. Enter flowstudy.co in the Google search engine. Once the Flow Study site opens up, then select St. Kitts and Nevis from the list of countries. Step 3. Choose Get Started. Step 4. Click on Login. Step 5. Enter the email address provided by the school, which will be your child's name. For example, Jennifer Jones at moestudents.edu.kn. Enter the password given, which is study SKN, capital S, common TUDY, capital SKN. Select the child's education level. You're in.
Hi, I'm Carla Berridge. Join me weekdays at 7 p.m. for Zaliza's evening newscast. We'll let you know what's happening in your community.
Extreme sadness.
Is on.
Good afternoon, and we welcome you once again to the National Emergency Operations Center COVID-19 briefing for the 17th of June 2020. We thank you very much for joining us today for today's briefing. We continue to manage in St. Kitts and Nevis the COVID-19 pandemic. It has not gone away. It is still with us, as we can see, all over the world, and even in our region, in Latin America and the Caribbean. I want to say a very special welcome to our new Minister of Health, who is here with us, and to congratulate her on the victory at the polls. We say a special welcome to the Honorable Akila Byron Nisbet, who has joined us today for the National Emergency Operations Center COVID-19 daily briefing. We also welcome Dr. Laws, our Chief Medical Officer from the Ministry of Health, and also Dr. Cameron Wilkinson, our Medical Chief of Staff at the Joseph N. France General Hospital. Whether you're joining us by television or radio or through social media, we thank you again for being here with us, where you can keep up to date and informed about how we here in St. Kitts and Nevis are managing the COVID-19 pandemic. Today, I will invite Mr. Crispin Boone from Boone's Environmental and Cleaning Services to make a donation to the COVID-19 response. Mr. Boone.
Greetings, everyone. I am the female version of Mr. Crispin Boone today. So I am here to present on his own behalf some information as to the donation that is being made to the COVID-19 task force and a little bit about Boone's Environmental and Cleaning Services. Boone's Environmental and Cleaning Services, of course, was established in 1995. They offer a wide variety of janitorial/cleaning services as well as indoor environmental services to our federation. Their cleaning services are offered to customers including institutions via their offices, residents, private homes, commercial businesses, and industrial businesses. Their motto is we clean anything, anywhere, anytime, no job too big, none too small. We are thankful to Mr. Crispin Boone today, who is donating to the COVID-19 resistance an infrared thermometer, LX26E, thermoflash. We are going to invite at this time the CMO, Dr. Hazel Laws, as well as Mr. Boone, to have the presentation.
Good afternoon, everyone. On behalf of the Ministry of Health and the COVID-19 Task Force, I want to say thank you to Mr. Crispin Boone from Boone's Environmental and Cleaning Services for his kind donation of an infrared thermometer. This is going to come in very handy in terms of screening persons either at our quarantine site or our treatment sites. Thank you very much.
Thank you very much, Dr. Laws and Mr. Boone. Thank you for your donation. I now invite Superintendent Cromwell Henry, who is Divisional Commander for District A, to give us the law enforcement report. Superintendent Henry.
Thank you, Mr. Williams, and a pleasant good afternoon to all listening to this broadcast by whatever media. Today I present to you the law enforcement report on the COVID regulations. New regulations have been published since our last briefing. These new regulations, which commenced on June 13th, will run until June 27th. The new regulations have eased a number of restrictions that were in place under the previous regulations. Before I highlight some of these new provisions, I wish to remind all that these regulations are intended to mitigate the spread of the COVID-19 and not intended to be punitive. We therefore appeal to your good senses and solicit your full cooperation. All businesses and offices may continue their business operations by allowing their employees to work remotely from home utilizing virtual means. Senior persons, older persons, or persons in the pre-retirement age range, and persons with chronic underlying conditions should be given priority to work remotely from home. Where a business is able to continue its operations, by its employees practicing social and physical distancing in accordance with these regulations, it may operate. Limited days of operation has been extended. These days now run from 5 a.m. to 11:59 p.m. This means the nightly curfew begins at 12 midnight to 4:59 a.m. During a day of limited operation, a person may visit a public beach between the hours of 5 a.m. to 6 p.m. for the purposes of swimming or exercise. No more than 5 members of the immediate family should be in close proximity to each other. There shall be no picnics, no beach parties or other gatherings, and all persons shall adhere to social and physical distancing protocols pursuant to these regulations. Also, during a day of limited operation, restaurants and takeaway food vendors may be opened up to 10 p.m. I repeat this. During a day of limited operation, restaurants and takeaway food vendors may be open up to 10 p.m. and may operate for the purposes of food delivery or food takeaway services, and may also offer in-dining service. So this is a new feature. You could now offer in-dining service up to 10 p.m. nightly. However, all persons shall adhere to social and physical distancing protocols and shall adhere to the hygiene protocols stipulated in the regulations. No more than 4 members of the same household should be in close proximity to each other. No more than 2 persons who are not from the same household shall be grouped together or share a table. The spacing between tables shall allow for a minimum of 6 feet between persons, and all persons, including restaurant staff, shall wear a face mask covering their nose and mouth except when eating or drinking. Bars may be open for the sale of liquor in accordance with the provisions of the Liquor Licenses Act. This means that the retail liquor license suspension is lifted. All persons shall adhere to social distancing and physical distancing protocols, as well as hygiene protocols pursuant to these regulations. No more than 4 members of the same household should be in close proximity to each other and shall be grouped, and no more than 2 persons who are not from the same household shall be grouped together or share a table. The spacing between tables at the bar or other seating arrangement shall allow for a minimum of 6 feet between persons. All persons shall wear a face mask covering their mouth and nose in accordance with the regulations, except when eating or drinking. Hi-Fi system operators or DJs and bands require written permission from the Commissioner of Police in order to perform in public spaces or at public events. However, the regulations restrict the hosting of public gatherings for entertainment purposes. Regulation 10 provides, no person shall host, attend, or visit a private party, a recreational or competitive sporting event, or other types of public entertainment, a banquet, ball, or reception, or any other ceremony in any facility or public place, a meeting of a fraternal society, private or social club, or civic organization or association, or any other type of social event. We anticipate your usual cooperation as we gradually return to a state of normalcy. Thank you.
Thank you, Superintendent Henry, for your report. I now invite our Chief Medical Officer, Dr. Hazel Laws, who will present us with the Health Emergency Operations Center COVID-19 Situation Report. Dr. Laws.
Thank you, Mr. Williams, and a warm good afternoon to everyone. The World Health Organization confirms or tells us that there are now 7,941,791 confirmed cases of COVID-19 globally. And if you were to look on the screen, you would see that there is an increase of over 3 million persons who have been confirmed between May 14th and today, June 17th. In terms of the death toll globally, that stands at 434,796, and then you could see the increase. On May 14th, it stood at 290,242, and so it tells us that the virus continues to spread globally. Let's look closer home in the Caribbean sub-region. There are 39,102 persons who have been confirmed with COVID-19. This is over twice the amount of those who would have been confirmed on May 14th. At present, the death toll in the Caribbean sub-region is a little over 1,000, and there is hope. We have 17,498 persons who would have been recovered so far. In terms of testing, we would have sampled and tested 417 persons to date, and we have received 402 samples negative. In terms of persons in quarantine, at present we have 25 persons in a government-designated quarantine site, and to date, almost 830 persons have been released from quarantine, and that is between February to present. To date, we've had 15 confirmed cases within the Federation. They have all recovered, and it's now 59 days exactly since our last announcement of a new case, which took place on April 19th. So yes, 59 days has elapsed since we would have announced our last case. Okay, now COVID-19 continues to spread, and so since the appearance of this new coronavirus some 6 months now, the search has been out for treatments to improve survival. The search has been out for vaccines to prevent this virus. Researchers in the United Kingdom are participating in one of the biggest randomized controlled trials, the recovery trial. Recovery really means randomized evaluation of COVID-19 therapy trial. Now, in this trial, they are looking and testing a range of potential treatments for COVID-19, including the use of low-dose dexamethasone, which is a well-known steroid treatment which have been in use for treating other medical conditions. And so far, over 11,500 patients have been enrolled in this research study from over 175 hospitals located in the United Kingdom. Now, this research work involves the testing of a number of treatment options, including lopinavir, ritonavir, which is an anti-HIV combination drug, and of course low-dose dexamethasone, which I'll tell you a little more about. And then they also looked at hydroxychloroquine, which was, spoken much about in February and March in terms of its potential in treating patients with COVID-19. However, based on the adverse outcomes, I think this is now thrown out the window. That's hydroxychloroquine. They're also looking at the use of some antibiotics like azithromycin and some anti-inflammatory treatment agents, along with convalescent plasma. Now, the recovery trial is it's well organized. It's a registered clinical trial with the Nuffield Department of Population Health in partnership with the Nuffield Department of Medicine, and the trial is supported by a grant from the University of Oxford. It involves many or thousands of doctors, nurses, and health professionals across the United Kingdom. So far, over about 2,104 patients have been randomized to receive this low-dose dexamethasone, about 6 milligrams of this therapeutic agent once per day, either intravenously or by mouth over a 10-day period. And the results are compared with 4,321 patients who were randomized to receive usual care alone. And the results or findings have been phenomenal. The researchers have found that dexamethasone reduced the number of deaths by 1/3 in those patients who were confirmed with COVID-19 and who were on mechanical ventilators. They also found that dexamethasone reduced the deaths by 1/5 in other patients confirmed with COVID-19 but who were receiving oxygen only. There was no benefit amongst those patients who did not require respiratory support. And so overall, the findings conclude, well, so far, that dexamethasone reduced the 28-day mortality rate by about 17%. And so this is good news. This is music to my ears, actually. Dexamethasone is the first drug to have been shown to improve survival in COVID-19. This is an extremely welcome result. The survival benefit is clear and large in those patients who are severely ill and who would have been diagnosed with COVID-19. And it's interesting, and for me, dexamethasone is inexpensive. We are already using it. We already have it in stock. In conclusion, COVID-19 is a global disease. It's fantastic that the first treatment demonstrated so far is one that is instantly available and easily accessible. Thank you.
Thank you very much, Dr. Laws.
Mr. Williams, I feel compelled to join you this afternoon in welcoming our new Minister of Health, the Honorable Akila Byron Nisbet, to the NEOC family. Thank you for allowing me to say this. Thank you.
And we invite the new Minister of Health, Honorable Akila Byron Nisbet, to share some remarks with us here at the NEOC. Honorable Minister.
Thank you very much, Mr. Williams, and thank you as well to the CMO. Good evening to everyone listening and viewing our COVID-19 daily briefing. I will be very brief, as I'm just here to recommit the support of the Ministry of Health to our fight against COVID-19. This morning, I was part of the HEOC meeting, and I was able to hear of what the plans are, what have been done so far, and what the plans are for what is expected to be the second wave of COVID-19. And I have full confidence that our team continues to do what is necessary to ensure that we're able to reduce or even be able to eliminate COVID-19 in St. Kitts and Nevis. I have seen the work that they have been putting in, and I also see the plans for when we do have to, because it's inevitable, we will have to reopen our borders at some point, and the expectation is that we would expect a second wave at that point. But I am confident that the team will continue to do as they have done in the first wave to ensure that we are able to curtail whatever the impact may be as it relates to COVID-19. The ministry continues to be cognizant of the fact that we are living in a global world where we expect that persons will need to be able to conduct business, and so we have to come up with solutions in order to be able to ensure that we have the safety of our country as well as the economy both in tangent with each other and ensuring we get the results that we desire in both. I am thankful to the NEOC. I am thankful to, I know he's not here right now, but the NDC and NEMO, who continue to work very hard in ensuring that we're able to meet all of our targets and goals, and the work that they have been putting in is commendable, as well as the rest of the task force, these men and women who continue to give yeoman service to ensure that our country is able to fight this disease, and we're able to ensure that the people as a whole are healthy and we stay safe. I also have to commend the people of St. Kitts and Nevis who continue to follow all guidelines that are outlined and continue to follow all the policies and regulations. It is because you continue to do what you're supposed to do why we're able to say that we are now COVID-free after 59 days. And I'm hopeful that once we begin to reopen the borders, persons will continue to listen to the advice of the health authority and the NEOC, and that we'll be able to curtail whatever the impact may be in the future. And so again, I'm just here to just recommit the support of the ministry, and myself as the new minister recommit the ministry and myself to ensuring that we do whatever it takes to support the efforts of the NEOC and the HEOC in fighting this disease. And so I'm looking forward to continuing to support the efforts as well, and whatever way, in whatever I have to do to ensure that we have whatever we need, I commit that to the NEOC and the HEOC. So with those brief remarks, I say thank you again to the NEOC, thank you to the team that's behind them, continuing to work diligently to ensure that our country is able to fight this COVID-19. Thank you so much.
Thank you very much, Honorable Minister. As you mentioned that we are COVID-free for a number of days now, but we're hearing of in some countries where they have relaxed some of the restrictions, like in the Middle East and Africa and China, there are now new cases, a second wave. I now invite Ms. Vesta Southwell, who is the Public Relations Officer at NEMA, to give us the NEOC report. She is filling in today for Mr. Abdia Samuel, who is chair of the COVID-19 National Task Force and the National Disaster Coordinator at NEMA, who is not able to be here today. Ms. Southwell.
Thank you once again, Mr. Williams, and greetings to everyone. Today marks the 81st day of activation of the National Emergency Operations Center, and accordingly, here is the report as at 17th June 2020. On the hotline 311, there were 6 calls received in St. Kitts and 0 calls received in Nevis. On 911, 6 calls were police related. There were 3 related to the EMS, 2 calls fire and rescue related, 3 calls required information, and there were 30 pranked calls, disappointingly, once again. At the St. Kitts NEOC, there were 0 calls received yesterday, the 17th of June, And in Nevis, there were 2 calls received at the EOC there. Following is the Compliance Task Force Assessment Review, and a number of businesses have been assessed between the 8th and 16th of June. There were 88 businesses, as a matter of fact, assessed. There were 6 salons, 6 food vendors, 0 taxis, 0 barbers. There were 0 bakeries, and bus 0. Clothing stores 4, rum bars, there were 5. Doctors, there were 2. Broker agents, there was 1. Supermarkets, 4. Restaurants, 6. Mini-marts, 6. And village shops, 3. There were a few others as well, including furniture traders, hardware stores, and insurance offices. The business assessments as at 8th to 16th June 2020, once again under the category of businesses, the particulars are as follows. Number of businesses adhering to the distancing rules inside, there were 87, 99%. I think that's an A+. 30 square foot per person observed, 87 businesses were in compliance, representing 99%. Distance markers at check-in points, 82 businesses were in compliance, that is a 93%. Distance markers on the outside, there were 82 businesses that were in compliance with a 93% compliance rate. Face masks being worn, there were 83 businesses, again in compliance, or 94%. Sanitizing doorknobs and hands upon entry, 84 businesses were in compliance, representing 95%. Again, business assessments as at the 8th to the 16th of June 2020 under the category of liquor establishments. Particulars are as follows. Rum/bar shops open, 3 shops were in compliance, or 60%. Liquors sold by retail, 3 shops, again in compliance. 3 shops in compliance, or 60%. Business assessments as at 8th to the 16th June under the category of personal hygiene with the following particulars. Practicing good hand hygiene, 84. Availability of hand sanitizers with 60% alcohol, 87. And soap and water being readily available for use, 86 in compliance. This is the same thing, I think. And that is the end of the NEOC report. Thank you so very much.
Thank you very much, Vesta, for the NEOC report. That brings us now to the question and answer segment. The first question goes to Dr. Wilkinson. Dr. Wilkinson, are we COVID-free in St. Kitts? And if yes, can we see a relaxation of these restrictions with respect to social distancing?
Okay, I will answer your question at the end of my comment, and you will see whether or not you will agree with me that we are COVID-free. We had our last confirmed case on the 19th of April, and as the CMO just said, we've gone 59 days without having a positive case. That is more than 4 incubation periods of the virus, or 4 14-day periods. We know that this virus is highly infectious, And so if it's circulating within a population, there would be some manifestation of the disease, because at least 20% of the persons may present with symptoms. We have been very vigilant in looking for persons with symptoms at all of our health institutions and at the Joseph and France Hospital. And we have not been seeing any persons with flu-like illnesses presenting either at our hospitals here in St. Kitts or in Nevis or the health centers. And so based on that information, I believe we can say, yes, we are COVID-free in St. Kitts and Nevis. The question is, though, what do we do with that information? Because saying that we are COVID-free simply speaks about where we are at this point in time. It's not a certificate that we put up on a wall to say that we are COVID-free until we have the next inspection a year or two from now, because that status can change tomorrow. It can change in another week. From the situation report, you heard that there were 20-something persons who were in quarantine? 25? Yes, and these are persons who are going to be tested when they're coming out of quarantine. We have persons who are continually returning home, and so at any point in time, the virus can be reintroduced into the population. Just at the last briefing, we spoke about New Zealand and the fact that they were COVID-free, and they now have new cases with a couple of persons who came back home to visit their terminally ill patients. And the minister just said that we cannot keep our borders closed forever because we can't stifle the country economically. So at some point in time, we're going to be opening our borders. And so I don't believe that it's anything that we need to shout and celebrate. It's an achievement, yes, but it's just describing the state that we are at this point in time, and it's something that can change. And so we cannot relax the non-pharmaceutical measures that we have been using, and so we need to continue to do our social distancing. We need to continue to wear a mask so that when the virus does come in, we can control the spread and we don't have widespread community spread within our country. Thank you.
Thank you very much, Dr. Wilkinson. This question has to do with the churches, and if there is any sort of a monitoring of the protocols that have been put in place with respect to the opening of churches, explaining singing guidelines and making sure that the guidelines are being adhered to. Dr. Laws.
Mr. Williams, that question is very interesting because I remembered standing in the stakeholder meetings, actually 2 of the 3 stakeholder meetings we had with the religious leaders, and we went through what the requirements would be, and I think we were saying that we don't think that it would be necessary to police the churches. I'll leave it at that.
I tend to disagree with that, but I think it's important to police the churches because churches are where, you know, people sometimes feel that they're in the spirit and they don't have to follow any sort of a protocol because the Holy Spirit will take care of them. This question is from WinFM. How many people arrested for breaching the curfew have been charged and placed before the court? Superintendent.
I do not have the exact numbers who were placed before the court, but I know there were 155 persons arrested at least half of that have been placed before the court. But I can get the exact figures for you later.
This question again is for Superintendent Henry, and it has to do with people getting together in homes for social gatherings, whether or not they can have a social gathering with 4 to 6 persons at their home, in their yard, and social distancing and the wearing of masks is observed. Superintendent.
Yes, of course, that is quite in order. We always advocate the wearing of masks and social distancing as a good measure to prevent the spread of the virus. And so if you have a small group of 4 to 6 persons and you're observing the social distancing protocols and wearing your mask, we have no objection absolutely to that, and you're entirely within the scope of the regulations to do that.
I do not have any further questions, and that brings us to the end of the question and answer segment for today's COVID-19 briefing. I want to thank you very much for your questions and for your continued support of our NEOC COVID-19 daily briefings, where we continue to update you and to provide you with information with respect to the management of the COVID-19 pandemic. It is very important that we note that, as Dr. Wilkinson said, that it has been said that we are COVID-free here in St. Kitts and Nevis. But if we look all over the world, we would realize that the world is not COVID-free. And we are part of the world. And so therefore, it simply means that we should still be concerned and we should not be carefree, but we should continue to put in place those protocols and the washing of the hands and the wearing of the mask and the social distancing that are so important. Because when we open our borders, we will have to maintain those very same protocols. And if we stop doing them now, it becomes more difficult to put them back into place. So I want to thank you very much for joining us today. We thank our new Minister of Health, the Honorable Akila Byron Nisbet, who came and definitely showed her support for all that is happening here at the NEOC with respect to the management of the pandemic. We do know that she will do a very good job in the Ministry of Health, and we want to give her all the support that we can. We also thank our Chief Medical Officer, Dr. Hazel Laws, who continue to provide us with update with what is happening with respect to the COVID-19 situation here in St. Kitts and Nevis. We also thank Dr. Cameron Wilkinson, our Medical Chief of Staff at JNF, who continues, of course, to provide us with answers to some of the very pertinent questions that you ask. We also thank Ms. Vesta Southwell for providing us with the NEOC report for today, filling in for Mr. Abdia Samuel, and Superintendent Cromwell Henry, our Divisional Commander for District A in the Royal St. Christopher and Nevis Police Force. We thank Mr. Boone, Mr. Crispin Boone, for his support of the work that is being done with the response to the COVID-19 pandemic. Thank you very much, Mr. Boone. We also thank ZIZ and all media for continuing to partner with us here at the NEOC in providing information about the COVID-19 pandemic. We also thank Mrs. Christmas Jacobs for being very faithful in terms of providing us with her sign language service. We will be back next week, Wednesday, for another COVID-19 briefing. Our briefings are now limited to once a week until it becomes necessary for us to have them more frequently. Until then, thank you very much for joining us. We will be back next week, Wednesday at 5 o'clock. I am Les Roy Williams. Take good care and continue to put into practice all the protocols, adhere to them, so that our country can remain COVID-free. Thank you.
Is on.